866.
The coronavirus touched every corner of the global economy, and beating it is key to any lasting recovery for both individual economies and the global economy as a whole. Saudi Arabia, their COVID-19 response is the envy of the world. They seized the moment when COVID-19 hit to take progressive, and I use that word progressive, measures to counteract the coronavirus, from curfews and safety preventions to effectively mandating a vaccine for all. And look at where Saudi Arabia is right now. They've had fewer than 100 new daily cases of COVID since mid-September. That sounds really nice. It's sort of like the kingdom tackled COVID with the benefit of hindsight. Just very interesting, from swift lockdowns to prevention measures. They've canceled the Hajj and scaled it back a second time. I mean, these were expensive things to do in the time. But as of today, 70% of Saudi Arabia has had at least one vaccine, and the economy is roaring back to life right now.
Envy is a good word, especially sitting here as an American. Envy is a good word. And it's really interesting you use the term hindsight. And so, before I get to that, first of all, Saudi Arabia has a legitimate reason to be really proud. Second of all, the regime has a legitimate reason to be very pleased, because this was a critical test of good governance, one in which any number of governments and regimes failed across the globe, including ours initially. And we continue to have problems, but that's less governance than just the social politicization of it. But they passed this test with flying colors. And so hindsight, you mentioned hindsight. They were really well prepared for this test. And so we have to remember that in an average year, to take out the pandemic in 2020, but typically Saudi Arabia has over 10 million pilgrims from 184 countries come to Mecca for the Hajj or Umrah every year. So we're talking 2 to 2.5 million, a very concentrated period during Hajj, and another 6 to 8 million over the course of the year doing Umrah. And so they're dealing with public health, infectious disease issues. And when you go back, again, hindsight, in 1996, you had the Asian H5N1 bird flu epidemic. 2002, SARS, severe acute respiratory syndrome. 2012, MERS, Middle East Respiratory Syndrome. 2020, COVID-19. Saudi Arabia has been practicing, and they've become really adept at dealing with this. And I want to read a couple of things here. The Saudi government's success in alert and response planning for infectious diseases is attributable to a multidisciplinary group of experts from various government sectors who are involved in advanced planning of health services, logistical support, and communications for the Hajj. Continuous monitoring of emerging infectious diseases ensures that, for example, infection with the MERS in an individual is not transmitted to other pilgrims. The Saudi government coordinates the Hajj activities through a Supreme Committee and 24 subcommittees for the Hajj. Based on three key planning considerations by Saudi government for communicable diseases, alert and response are all based on WHO's recommendations for World Health Organization's recommendations for communicable disease alert and response during mass gatherings. During the height of the pandemic in 2020, Saudi Arabia allocated an extra $12.5 billion to the healthcare sector. This is in addition to the $45 billion that was already budgeted. These sums helped expand the provision of additional beds for critical COVID-19 cases, including the designation of 80,000 beds across 25 hospitals, which included 8,000 intensive care units and 2,200 isolation beds. Separately, the funds helped facilitate the rollout of a free countrywide mass rapid testing program. So Saudi Arabia based on its experience of having these 8 to 10 million pilgrims every year, based on these previous epidemics, responded appropriately, and they responded according to science. And it's, as I said, I'm envious. They were decisive, and they were persistent, and they didn't relent too early, and they started early and they didn't quit early. So they have a lot to be proud of. I should also add, one of the things that was part of this was this the telekalna application, which is on phones, was introduced to track the spread of COVID-19. It would allow you to get into some place, school or a restaurant or wherever. It has 20 million users, and now is being adapted to do, include your passport data. So this is, a digital technology that was applied in response to a public health crisis. Again, part and parcel to what was an intelligent, full-bore, science-based response. And boy, that would be nice.
That would be nice. What's interesting to me that since the coronavirus started, I've always sort of thought of Saudi Arabia as being well positioned to deal with the coronavirus because of the way that its government is structured. I mean, one of the reasons why we had such terrible problems in the US and why they're still ongoing is because we have 50 governors, we have all these, and then local ordinances, counties, all of these different systems of government working together. The great democratic experiment is just so poorly equipped to handle a pandemic where you really need basically a strong hand to say, this is what we're going to be doing. Everybody get on board with whatever program we're going to do. We are locking things down. We're shutting down flights. There's no debate here. This is just what we're going to do. And I'm not like saying that I'm envious of their system of government necessarily, but at the same time, when decisions need to be made and they need to be made swiftly and decisively, you can make them in Saudi Arabia. I mean, they shut down the airports, they stopped, international flights, they canceled a huge event. I mean, the Hajj. It's just interesting because
twice.
It's like they have that twice. Yeah. They have the sort of government structure that's built for fast decisions, and they have enormously popular leadership. Where people are going to follow the line, and look where they are today. I mean, it's just amazing. Fewer than 100 new daily cases of COVID. I think the United States had 70,000 yesterday, and we're sort of on the decline. It's amazing. Of all 259 million cases worldwide, Saudi Arabia has had only 55,000 of those. So just I mean, it's amazing. And now that with oil prices high, they're opening things back up. Riyadh season, I mean, things are back in Saudi Arabia.
It's funny that you should mention that. So I have in my notes here, I have keys to success. 1, authoritarian government. 2, financial means. 3, follow the science. 4, be decisive. If you really wanted to be cynical about this, it would have been Saudi Arabia. You could really criticize Saudi Arabia if it had whiffed on this. I say that because as you say, the system was in place, the means were in place, the experience was in place, the proclivity to follow the science was in place. So it was really set up for Saudi Arabia to succeed. But that didn't occur. That was earned expertise, earned experience. And they took what they have, their assets, in terms of this crisis, which is a centralized authoritarian government, and the financial means to do what needed to be done. And they implemented it. And they should be very pleased. And they're reaping the benefits, like you say. The economy's bounced back, and things are going nicely now. I think the Saudis feel very, very good about how they've weathered this storm.
It was interesting at the height of the pandemic. You had Ramadan, at least once you had Ramadan, which is a time where followers of Islam gather together in the evenings, and that was a really. It's not like Saudi Arabia had an easy time with the coronavirus. I mean, we mentioned that it was expensive, but
No.
Socially it was also very difficult. Saudis are very welcoming, hospitable. They like to spend time together. Everybody does, but I mean, just especially during that time, and It's just interesting because during Ramadan last year, I'm sure it had a very weird, strange vibe for Saudis. Just, getting together and having to be very careful. And that is right around when we saw some big spikes in Saudi Arabia. And then, slowly and surely they've held the line. Like you said, I love that 4-part thing. I wish we could, for the next pandemic, we're going to have to get that playbook in the mix. But
yeah, I know.
Just very interesting.
And so we don't have to go back and do an error statement. They did cancel the Hajj in 2020. This year it was reduced considerably, only 60,000, and only people from Saudi Arabia.
Those photos were really strange to see because it was the Hajj, as it always is, the same photos that always come out from the SPA. But instead of having 2 million people there were like, what do you say, 50,000?
60,000.
Yeah, so it looked like sparse. It was very strange and orderly. There were like, space in between pilgrims, kind of cool, but also a little strange to see.
By the way, that reference to authoritarian regimes, and we're going to have a conversation about that at some point, about the evolving sort of political approach that a lot of countries are having. So I went and looked on the Economist Democracy Index for the year 2020. And they list 4 types of regimes: full democracies, flawed democracies, hybrid regimes, and authoritarian regimes. And I'll just ask you, what's your guess in terms of full democracies, the percentage of countries in the world that are classified as full democracies?
Does that include like representative republics, or is it just like full on like?
I don't have the exact definitions of what they are, but it's what you would imagine as when you draw up a fully realized democratic state.
I would say it's small, a handful.
But
I'm trying to hedge because I don't actually know.
That's perceptive of you. All right, so let me just, full democracies, 23 countries, 13.8% of the global 13% of all countries. Let me do it by world population, actually. So full democracies, 23 countries, 8.4% of world population. Flawed democracies, of which the U.S. is listed in this one, 52 countries, 41% of the global population. Hybrid regimes, 35 countries, 15% of world population. Authoritarian regimes, 57 countries, 35.6% of the world population. I only say that because labeling is problematic in many ways, and autocratic, authoritarian, monarchy. So and Saudi Arabia doesn't rate very well in this democracy index, as do a lot of other countries. But it's interesting to see this rundown, and it's interesting. It would be interesting to go back and see how the full democracy and the flawed democracies did in this COVID epidemic, because we saw ours, and it certainly stumbled out of the gate.
We're still seeing ours. We are still battling COVID, and it's not a beautiful thing to watch. It's really quite hideous, actually.
It is in many ways.
Fascinating. And just wanted to add one more thing to this discussion. Judwood Investment had a really awesome sort of research note that they came out with this week, and we included it on our website and our daily newsletter. Really interesting stuff, not just about the COVID-19 response and all of that stuff that went into it, but what is ahead for healthcare in Saudi Arabia in the run-up to 2030. It's going to be a huge sector. It already is a huge sector, but Saudi Arabia's population is so young, but as they get older, that brings with it all these different health challenges and opportunities. So check that out on our website, sustg.com. Really cool report. And you can find it's full of graphics and stuff. Just fascinating if you're interested in that sector.